Hello everyone, this is Bob Ranner recording Community Coronavirus Update number 79. The topic today is, will the College World Series be a super spreader event and does it matter? So we do know that sporting events can be super spreader events. So yes, they're outside, which makes them safer. However, that doesn't apply in a crowded stadium where people are shoulder to shoulder. And quite a few articles showing that essentially one of the biggest super spreader events that started this off in both Italy and Spain was the Atalanta-Valencia game, which then brought a lot of the coronavirus to their respective cities and caused those first bad outbreaks in Atlanta and Spain and Italy. So we know this happens. Dr. Scott Gottlieb seems to be on every news channel these days. He's claiming that yes, the COVID variant is potentially a risk, but probably not till this fall. I think it could actually be sooner than this fall. And kind of what prompted this, a newspaper reporter asked me, will the College World Series be a problem? And I said, I haven't really thought about that, but let's put some numbers to that and let's see if it really would be a problem. And so I threw together this model. Now, keep caution, of course, like my graduate professor used to say, all models are wrong, but some are useful. So this isn't a perfect model. It's me throwing it together. However, some of these numbers are pretty solid. So, for example, our rates of infections per 100,000, we can pull those off of government websites, for example. We know we've got some good ideas on good studies on underdiagnosis, duration of infection, things like that. And so some of these things we can put together a range of possibilities that are pretty likely, actually. So, for example, Douglas County today has 2.0 per 100,000 as the listed case rate in Douglas County, and we can pull the vaccination rate, which is 59.3% right now for over 16. However, at the College World Series, this isn't just going to be Douglas County residents. It could be people from all over the country. So maybe we should use national numbers, in which case we can look that up too. We can see that nationally right now, current infections is about 4.2 per 100,000. So maybe we should do a range, Douglas County and national. As far as how long are people infectious when they're diagnosed, well, we actually have good studies on that now. We know it's roughly about 7 days, 2 days before they are symptomatic, which is our problem. If people are infectious before they realize they're even infected. That's one of the challenges of coronavirus and why it spreads so much. We also know what the underdiagnosis is, meaning for every positive we get, there are actually probably at least four other that are positive that never go diagnosed. And this was there's multiple studies, including one here at the University of Nebraska, where they did this in Omaha Public Schools, showing that we're not identifying a lot of people are infected with testing because testing is too restrictive and hasn't been wide enough. So we can put these together in our model, and we can use either Douglas County rates of spread, national rates of spread. The underdiagnosis, most people are saying 5 is pretty solid, so we can stick with that one. If people are infectious for 7 days, I wouldn't use 7 days as the full. I'd probably use a shorter number because some people who are infected and have symptoms would hopefully not come to the game. Now, it's hard to predict the human behavior on that, so rather than 7, I'd use 4 or 5. So we know the number infected per 100,000, divide that by the number of attendees by the game, we can say that there's probably somewhere between 6 and 16 people who would show up at a game that are infected. Next question, of course, is when those people are infected, how many people do they expose? And that's, I think, probably one of the biggest ranges of uncertainty. So, picture a guy standing in the stands who's cheering and yelling, spreading droplets to the rows in front of him. Or if those rows are fully packed, he could easily infect at least 10 people, if not 20, in front of him. So that's why I use this range. Plus, there's the concessions land, there's the walking up the concourse, standing in line for the bathroom and the bar afterwards. So each of those people is probably going to infect, easily 15 to 25 or expose 15 to 25 other people. Now, those exposures may not result in infections because, hopefully a lot of them are vaccinated, and some of the unvaccinated might be partially immune. So we can pull some of those numbers too and get some ranges of estimates here. And we can pull these and other things. We actually can figure out capacity because we know what the capacity of TD Ameritrade Stadium is, and we can look at past attendance to see kind of what roughly it is, and it's roughly in the 20 to 22,000 average attendance, and it looks like they're going to have full capacity, so we know we can use that number. We do know that although people have some immunity when they get infected, it doesn't last as long as we would hope. So this study in Manaus, Brazil, showing that yes, they thought they'd gotten to herd immunity the natural way, only to find out that when the P1 variant came by, that immunity didn't last, and they had a bigger outbreak than the first one. We also know that we can watch United Kingdom, where they had the B117 variant go racing through, and it looks like they're already getting a resurgence again with the Delta variant, which is also coming to us soon as well. So we know that this is happening. It's happened in Manaus, Brazil. It's happened in United Kingdom. It's probably going to happen here too. Um, Also, that there's this article some folks showed me, the power of natural immunity, but people forgot to read the next line, which is if you've had COVID, you can get by with one shot, maybe not two. It doesn't say you can't get away with zero shots, and that's basically showing that having coronavirus the natural way is about equivalent to one shot, not two. And how does one shot work against the new Delta variant? Well, studies from the NIH showing that it's only about 33% effective, so that's why I use that 33% number in the model. So here we have 33% partial immunity. That assumes everybody has had an infection previously. That's probably not the case, so we might want to use 25%. So we use these ranges, both conservative to liberal, to see kind of what our range of potential infections might be. And then we carry those newly infected people to the game five days later, another game 5 days after that, and you see that the extrapolation gets pretty wide, hundreds to potentially tens of thousands. So, could the College World Series be a super spreader event? The answer is yes, it could be. Now, I don't know for sure what this range of uncertainty is. There's a lot of areas, and that's why we do models and we predict ranges. We don't give any certainty because we can't. Um, and this is why people are producing models like this. So, for example, what would happen with the very vaccinations versus, and whether we drop non-pharmaceutical interventions. This is what I talked about last week. And what you see is that when you drop all non-pharmaceutical interventions, you get a pretty wide range where actually it could be just as bad as previously because you dropped everything. So that's the problem in the United States. We seem to slam on the brakes and then stomp on the gas, slam on the brakes. So we're kind of whipsawing back and forth between shutdown and nothing. And I think that's our problem here. Could we have done something? The answer is yes. So, for example, when we put masks on everybody, that reduces spread by about 85%. And if you apply to that model, you actually reduce spreads down to hardly any, basically. However, that's probably not relevant because no one's going to wear a mask. Who wants to wear a mask out at a hot baseball game? So that's probably not going to happen. So discount that one. Other things we could do. Well, we could do capacity limits, and that actually was the original proposal, that it cut the spans in half. Well, that obviously reduces half the exposure because half the people aren't there, but also spaces people out. So there's a further reduction because people are more spaced out. So you'd expose fewer people that way. And so that would actually almost get rid of the possibility of a super spreader event, but they're removing all capacity limits. Is there another option? The answer, yes, there's another option we could do. We could safely have people fully in the stands and without masks if we did one other thing. Unfortunately, we're not going to do that either. And so that would be, for example, the pre-testing. So when my wife and I went to Hawaii for our anniversary a few months back, you had to have a test 3 days before you left, and then again on arrival. And then if once those were negative, you had these two check boxes on your app. And when you rented the car, checked in the hotel, you showed these two check boxes, and you were good to go. You didn't have to quarantine. Same thing could be done for a baseball game, for example. It was done, for example, at the University of Nebraska for graduation. So all the kids showing up to graduation were supposed to get tested ahead of time. You just went by the spit check, got tested, and there you go. We could have done something like this. And if you could identify 3/4 of the people who were infected, applying that to the model, you could also prevent this from being basically a super spread event. But unfortunately, we're not going to do that either. So, we can prevent these things from happening if we do something. Unfortunately, it looks like we're just dropping everything and letting her rip. So we'll see what happens. The question is, though, this was an interesting article from Jay Varma, is a physician epidemiologist talking about, at some point we should get rid of mandates and restrictions because, you can't do this stuff forever. And he makes a point that, people who don't want to get infected had the choice to get vaccinated at this point. For the most part, that's not wholly true, unfortunately, but partially true. So you could just say, people going to the game who want to protect themselves and get vaccinated, and the rest, well, it's up to them. It's a free country. Let them do whatever they're going to do. You could look at it that way, actually, and I think it's a political argument out of my control, of course. But what's the result of that? Yeah, I guess it's their choice. But given this range of uncertainty, given a 3% hospitalization rate and a 0.5% mortality rate, we're talking 3 to 51 deaths just for these 3 games alone. That doesn't include everything else. So we could be talking anywhere from dozens to hundreds of deaths of this, depending on which of these range of uncertainties is the more accurate one. And I actually don't know. It could be more this side. It could be more this side. But we are talking about potential hospitalizations and deaths that could have been prevented had we done something like pre-testing. But we're not going to do it. So, does this matter? Well, it kind of goes back to sort of that individual versus collective decision making. At the individual level, my individual risk, especially if I've been vaccinated, is so low that I probably wouldn't worry about going to the game. If you're a basketball fan, you've been vaccinated, go there, don't worry about anything. But it's the unvaccinated the problem, and there is a collective risk problem because some of those people who die, well, some of those people are the breadwinners of their families. It doesn't just affect them, plus the healthcare costs and everything else. This is a problem. We'll find out with the results probably in about 2 to 4 weeks after the College World Series is done. We'll see whether this was a good idea or not to do this with no non-pharmaceutical interventions at all. But we should learn, if it is a problem, we should learn from it and hopefully do something different for the Husker football games this fall. We could put in place a pre-screening mechanism to make sure that everybody going to the game isn't infected and they can exempt themselves if they're vaccinated. We could put that in place, and I think we should actually. Also, implications for the schools this fall. We could do the same thing. Kids who are vaccinated don't need to do any of this stuff, but people who aren't, elementary schools probably no one will be vaccinated by the August, but we could do some things like surveillance testing, like the wastewater school at the elementary school. If it's negative, there's no coronavirus there, people don't have to wear a mask, or we could do some surveillance just using the saliva testing, for example. We could have this all in place by this fall and make school a safe thing even without masks. And my hope is that we can start school without masks this fall. But these are the things we need to think through, and hopefully we'll have a state plan in the next month or two because we could prevent this risk if we really wanted to. The new variants are on rise. There are going to be problems, and so people need to realize we are not done with this yet. We still need to do some stuff here. Some good news, at least. The new Novavax vaccine data is really good. It's showing to be as effective as all the other vaccines with some other benefits. One, it's easier to store. Second is it may even have fewer side effects for administration. And so really good views in the Novavax. So we're just getting more and more vaccines, and this is important because I do think there's a good chance we'll need boosters in the next 6 to 12 months. But this could make things even easier for all of us. But we do need to keep things in mind that we're not past all this. So United Kingdom, I think, is showing that what happened in Manaus, Brazil, is now happening in the United Kingdom. Hopefully, the spike won't get anything like this, but it is going up, and I'll be watching this pretty closely, and hopefully we don't start seeing the same thing across the United States in places with low vaccination rates like Arkansas and Wyoming, Alabama, places like that. So hopefully this is helpful to you. Again, these disclaimer, these are my opinions, not necessarily of all these people I work with and for, but you just kind of know it helps you with a little bit of my background. And of course, you can look at the past episodes on healthylincoln.org.